We are Development Solutions. Our mission is to increase the quality of education and health services infrastructure to break the cycle of poverty in Côte d'Ivoire. GDS is dedicated to building partnerships with local civil society organizations and to target beneficiaries to increase the standard of living around Côte d'Ivoire. Our vision is that by increasing resources in these two sectors, we can help increase literacy rates and decrease the rate of HIV infections nationwide. Currently, the three top development priorities in the country are: first, increasing literacy rates and years of schooling; secondly, increasing life expectancy and quality of living; and thirdly, establishing disease prevention to counteract the AIDS and HIV epidemic. With our partners, Teachers Without Borders, the World Health Organization, and CARE, we hope to make a lasting impact in the following sectors of education and health. In the Ivory Coast, quality education remains low. Literacy rates in 2014 were 53% for youth and 43.9% for adults. Several issues driving the lack of education among the population include large student-to-teacher ratios and poverty that drives child labor, in part keeping school enrollment low. We hope to address this issue by partnering with Teachers Without Borders. With more teachers spread evenly in urban and rural areas, class sizes can become smaller, allowing students to receive more one-on-one assistance. Like many other countries in sub-Saharan Africa, HIV/AIDS is one of the leading causes of death in the Ivory Coast. As of 2016, there are 460,000 people living with HIV, including nearly 36,000 children. As adult women are more affected by HIV, the rates of child infection from breastfeeding and the number of orphans remain high. We hope to open a community center near a hospital already known to the community as a safe environment for women to gather and receive free contraceptives to voice their concerns. Here, women and girls can escape chastisement from others and be encouraged to seek help. As part of our nationwide awareness campaign, we seek to partner with the Soccer Federation to host football matches, which will advertise and promote our national campaign for the prevention of HIV. We hope to suppress dissent of this campaign by gaining the support of political leaders and healthcare professionals who share our concerns on the health situation. With a $1 billion grant from the Luna Foundation, we hope to implement a 7-year development program to increase literacy rates among youth and reduce the rate of HIV infections among children in particular. We hope to receive feedback from our beneficiaries in order to correct our methods and create a lasting impact. We hope to ask students in class about their experience and have adults rate our services through SMS to capitalize on what works and improve our services. For the education initiative to increase literacy rates, we hope to have smaller classes, reduced teacher absenteeism, which will lead to higher retention rates. Also, we want to diversify our pool of educators and increase the quality of education. For the Education on Health initiative to decrease risky sexual behavior, we hope to spread information to areas not previously informed, which will increase awareness of risk of HIV. Also, we hope to provide free contraceptives in a safe environment, which will also decrease risk of infection. For the health initiative to decrease the spread of HIV, we hope to create a restricted environment for women and girls to learn of health risks, which will decrease rates of intergenerational sex. We also hope to provide free vaccines for mothers at risk or infected with HIV. This will decrease the risk of infecting children. We believe that our education and health campaign will provide practical solutions for sustainable development in Côte d'Ivoire.